About 2 years ago, the chiefs of British Columbia gave the First Nations Health Council marching orders to begin the work to create a BC First Nations Health Authority.
In the overall scheme of things, we're currently in the final stages of concluding the Phase 1 transfer, which is the transfer of the headquarter functions that supported the First Nations Inuit Health Branch programs and services that are delivered here through the region. And we are now in the process of getting ready to implement the beginning of the First Nations Health Authority running the headquarter functions of the non-insured health benefit program.
There's been so much work done in terms of getting all of the necessary sub-agreements done that we're required to complete as part of the framework agreement.
But I think now we're going to actually see some real change on the ground. We've actually signed some partnership accords out in the regions. We really see that it's through those partnerships where the actual change will occur mostly.
We need to talk about building blocks for transformation because we have to get ready for the work in front of us. And for the First Nations in British Columbia to really look at governing the health services that are here for First Nations people, we have to get our minds around how we want to approach this work moving forward, because the way that these programs have been delivered through Health Canada in the past and through the current arrangements may not be the best, and First Nations have to decide what the best approach is.
We can class o matsakakna kista waya tlau yakati hawaya anamadas umhaitsakshit. My name is Weekin Inish, and I'm going to talk about my great-grandfather Kista, who was a whaler. Over time, my great-grandfather harpooned only 3 whales, and largely due, as my father explained to me, was that someone in the crew did not prepare. And the importance of preparing for such a major event, the acquisition of food for the whole tribe, it took a lot of preparation and teamwork. Physical, spiritual preparation, and was so important by every crew member, and incredible powers were generated by the actual preparation. When he succeeded, he fed the whole tribe, and for a period of time, and it was a good time for the community when a successful whale hunt was concluded.
Reciprocal accountability is one of the building blocks for transformation because all of us have a responsibility in working together to ensure we improve health services for First Nations people. So we need to think about what reciprocal accountability means for us.
For me, it means a manner of engagement that involves everyone from the community level up through our leadership to our organizations, and allows for everyone to be clear and accountable to each other.
I will get in the trenches and do the work. I will do what I ask other people to do. And I don't think that's too high of an expectation. If it's going to be reciprocal, it has to be absolutely reciprocal.
I have seen it happen where a patient will say, somebody help me, somebody do something because something bad's happening to me, and abdicate their responsibility for their own health and well-being. So we can be mad at doctors or the system for not giving us what we need, but in return, we say, did you help the children brush their teeth? Did you quit smoking when you were given the chance? Did you look after yourself? So those ideas of personal responsibility, as well, of course, as communal responsibility are important ones to keep active.
According to our culture, you're one gift. That's what you look after in your family. Then you have extended family members who have another gift. And then another family member has another gift. Another family with another gift. When you put all of those gifts, all of those strings together, you become a whole, strong family, interdependent upon one another.
Everyone had a role and responsibility, and if one of them didn't do their role, then community was affected.
Throughout the years that I've been a chief, I've noticed that we've had more success when the community gets engaged first, because the community is what's driving this process. It's the community members that we're sitting at this table for, advocating for, because they're not at this table. And the community knows what the problems are, what the solutions are, and we need to tap into them to validate what's going on for them. As far as the regional level, our responsibilities as the representatives from the First Nations Health Council need to ensure that we set the table for everyone, that everyone from the regions, the chiefs, the leaders, the nurses, the health leads, and the communities are there to help us, to inform us so that we know what we're advocating for.
So, our people, to be reciprocal in their accountability, not just the chiefs, not just the health workers, but the community have to rise up and begin to live their life at their personal best and realize that they're worthy of a healthy, wholesome life.
I'm here to talk a little bit about the petroglyph within our traditional territory on the Harrison River. That petroglyph is called the timeline. One of the things my grandfather used to talk about when we talked about the timeline was that the time that we have in the physical world is really, really short. The time that we're here is just prepares us to be moving on into the spiritual world. But while we're here, we were supposed to look after everything. We're supposed to take care of all of the resources, all of our songs, our ceremonies, our beliefs, so that 7 generations coming behind us have the exact same thing that we have.
I'm a mother, and I've given birth to a couple of children, and that's really a significant moment when that child is born. It's there and it's right in front of you, and it's like, wow. But that child doesn't now just start to say, oh, I'm going to need some diapers. Oh, and by the way, I'm going to need some formula maybe if you're not going to breastfeed me, and I'm going to need these things. Well, if I hadn't been doing the planning for those 9 months of pregnancy to actually be ready for that birth, my gosh, there'd be a lot of stress on that day. There might be a child with nothing to be wrapped in, no clothes, no food, and that's not going to be a happy child.
Planning is not a new concept for First Nations people. Our ancestors had the ability to plan to ensure that their communities and families were sustained in a safe environment.
The First Nations Health Authority is currently establishing a process to plan for the long term. It's an incremental approach based on the phase transfer and the capacity development within the First Nations Health Authority and the processes that are being established within the regions to support community planning and regional community planning. The issues with the current planning process is that it's very disjointed. Communities plan in isolation from one another, and that's reflective of the arrangements that we've had with Health Canada. And moving forward, we want to ensure that we no longer plan in isolation of one another.
The First Nations Health Authority planning cycle is one that is envisioned will build from the ground up.
We need to ensure that plans come from community and rolled up to a regional level, and then to inform a provincial health plan for First Nations people.
The reason that we're doing this work, I think, is that we're trying to get to a place where First Nations have a voice in the planning and management of our own health care in this province.
At the community level, what's needed in planning is to ensure that we have clarity on what the community is saying.
It's not like the bureaucratic way of, okay, let's put them in a room and let's see what you have to say. Okay, planning at the community level is going through to everybody's home sometimes, having tea, to hear what they are.
You can plan any program you want. If it's not what the community wants or needs, they're not going to show up. It doesn't matter what you do. So if they're involved in the planning and in the programming, then they are going to show up and they are going to take part. And that's most important.
At a regional level, we really need a lot of collaboration. We need communities to work together to identify collective priorities across the region, recognizing that not every need that we have can be a priority. At a provincial level, we have to be responsive to be able to find a way of addressing the various regional priorities that come forward and perhaps identifying those that are collaborative among the 5 regions or common among the 5 regions where we can ensure a collaborative mandate can address those needs.
Which will then contribute to strategic planning and thus build from the ground up and lead to an effective province-wide approach to programs, services, and attaining health goals.
So it's important to have the communication and have the working together that the Health Directors Association is providing to make sure you tie in all of those pieces so that the voice comes from the community.
I would say evaluation, however, is a way that relates to the planning cycle and really assists you in doing course correction, determining the effectiveness of your planning measures and of your intervention measures.
So we're actually looking at evaluation as a way for improvement. It's not a punishment thing, and that's something that we've actually, again, been conditioned to. Because it's been somebody from the outside saying, do this, and then we do a little differently because we know we have to. And then they come in with their evaluation tool or their lens and go, oh, you've done it not in accordance with what we've told you to do. By creating evaluation process for ourselves to evaluate the things that are important to us, there'll be more meaning at the end of it.
Are we achieving the expected outcomes? Are we doing this the smart way? Are we doing this in the best way? Are we making sure that we're not wasting funding our opportunities?
We have stories as the Dunaka people that talk about how we're to prepare ourselves for giving birth, basically. So we have stories that say, when a man and woman are thinking about becoming parents, that they have to make sure that they have their house in order first. So they have to make sure, basically, what those stories talk about is being able to protect and provide for the children that are coming. So that meant basically that our men and women were to become the most healthy they could to become parents, so that our babies can grow to be the healthiest, strongest people that they can be.
Data governance is an important building block for transformation because today in the world of data, we really don't know how well our people are doing in terms of our health outcomes. And the kinds of things that are being measured are really around how sick we are and not from the perspective of how well we are.
These days, we cannot make good decisions, either business and in this case, wellness and health, without good information. And the root cause of many issues with of lack of information, particularly in my business, is the lack of data governance.
Data governance is basically taking governance, the ability to make good decisions for your own people, and being informed in that process by having data, which is basically packaged in many ways to inform you.
Currently, the data system about First Nations people is reductionist. It only measures a certain few things like mortality, morbidity, those kinds of ideas, and they're rough measures of our health and wellness. If the average life expectancy for an Aboriginal man is 63, that doesn't mean that I'm going to live only to 63. It just means that on average, men like me will live to only be 63. So it's a generalization that may or may not be helpful.
If we are creating these realities in our community or these pictures of reality and we're saying bad, 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 we start behaving that way. We start living that way. We start creating the expected picture of ourselves. Oh, you're a sick Indian. Okay, well, this is what I'm supposed to be, so it's okay if I behave a certain way.
The idea then is for us to gather data that is truly meaningful, that maybe trying to guess how long someone will live may not be as helpful as information like how many men my age are dying from lung cancer from smoking. Because if it's high, and unfortunately it is, maybe we could spend some of our time and energy supporting people when they want to quit smoking.
What we envision is having a a real opportunity to engage with research community, with our elders, with our key players to look at what are effective wellness indicators, and to do so in a way that contributes to our go-forward interests.
So an example, I participated in a process last year where I was looking at Indian Affairs, ANSI, Aboriginal Northern Affairs, and all of the data collection work that they do, okay, just within one department. So they've got 20 different divisions within that one department. They were trying to come up with a formula, no less, to measure when a First Nations person has returned from work from welfare. So here's Gwen from the community, and I'm looking, and there's all of these senior bureaucrats, and they've got a formula emerging. X number of Indians over X number of Indians divided by blah, blah, blah. And I'm like, really? I said, I saw Marty getting up at 7:30 and leaving and coming back at 5 for the past couple weeks. I'm thinking Marty's back to work. They're going, who's Marty? I said, my neighbor. We know real time in community what happens. None of your data collection exercises will ever give us that.
So if we take over data governance, we'll have all the data in a holistic manner. So we can also move from that sickness model to a wellness model.
So that's what data information should be about. It should be meaningful, not just data for data's sake, but meaningful data that gives us a direction to take action. Not just hold data and knowledge, but take action.
When you have to pay for your own expenses, you become more prudent. When I got married and I had to pay for my own electricity and my phone bills and put food on the table, all of a sudden I had to rise up with my responsibilities as a man. And it's the same difference for a community, a nation, a country.
All the money in the world will not build a perfect health system for closing the ill health that First Nations people face, but I think by maximizing our resources and planning collectively and sharing best practices, we can achieve some results.
A great challenge to being sustainable is that the needs of the First Nations people are really outstripping the funding that is available. The First Nations Health Authority needs to put itself in a position to generate its own resources and create its own opportunity to balance and to make that difference much smaller.
I think some of the challenges in becoming fully sustainable really result from the current situation of having 203 communities located across the province of British Columbia working a lot of times by themselves on health services. And so with the health plan, we have the opportunity for the First Nations Health Authority to be more of a partner with those communities and to support collaboration at a community and regional level to try and address some of those smaller economy of scale issues that might exist in that environment.
Business development is probably the biggest area that we can do. There's lots of opportunity for the First Nations in BC and the First Nations Health Authority to have ownership of businesses that provide services to the health benefits program. In particular, the one that people talk about most are pharmacies and dental clinics. And what the opportunities that these things provide are they create jobs for community members. It creates a bit of an economy where more of the funding and more of the money that comes into the programs touches First Nations hands more often before they leave the circle and going to other areas.
When you look at Alaska, you'll see regional health corporations that run programs and services for large numbers of tribes on the ground in Alaska. And so the economy of scale that they create, not only for employment but for service delivery, allows them to do things in a different way than what we're able to do here.
The other area of work that we're really excited about is what we learned from the Big Stone Cree First Nation. They took on the transfer of the non-insured health benefits program. and they generated profitable businesses. They own their own pharmacy, and their pharmacy generates jobs and revenue for their community. That revenue is plugged back into their health programs.
We have a wealth of innovation in e-health, and it's a new concept worldwide, but it is proven to be effective in the north, so why not use technology to bring specialists via e-health to communities? And I think that's a success where we could minimize some of the costs associated with patient transportation and bringing the services to community via technology.
Everything that can be done at home is done at home. Everything that can be done on the phone is done on the phone. Everything that can be done online or electronically is done online or electronically. That we make sure that we have the money for the people that need the help the most. So that's where we want to head to. We want to move to more investment in the prevention of disease, more investment in health promotion. And so the kinds of things that we're doing now, like the Beefy Chief Challenge, that's all about us identifying health champions, promoting our personal responsibility for well-being, and giving ourselves the opportunity to move to a wellness model of care.
I'm really excited and proud of the work that's been done, because in a lot of ways we're moving beyond colonization and we're moving to a place where First Nations are once again taking a role in being self-determining and making decisions about our future for ourselves.
I think we owe a great deal of thanks and respect to the leaders of the past that probably foreseen this way before we even knew that we'd be even at this place where we're at right now.
The work is just beginning now. We have 20 years of hard work to do. 20 years of continuous change. 20 years of tackling and resolving issues and problems. And so the work is really just beginning.
We're looking at health in a whole responsible way. We're not saying we want you to fix us. We're saying we need to take responsibility to fix us. That's what I really like about what we're doing. I'm really proud of that.
I have one grandchild, and someday I am sure and I am positive that I am making a difference in his health and his children's health. And that is why I'm here.